the latest on the pandemic as Missouri's 7-day average of positive tests is up to 14.6%. In Kansas, the monthly percentage of positive tests is now 16.3%. Wichita's two major hospitals are out of intensive care unit beds after a spike in COVID cases. At both hospitals in town, all 208 ICU beds are in use. Sedgwick County is reporting its highest hospitalization numbers since the pandemic began. The Wichita mayor has also said the city is hitting a tipping point where it could start losing lives because of the lack of hospital ICU beds and staff.
The number of COVID patients in Missouri hospitals reached another record today. One of the state's largest healthcare providers has called off some elective procedures. A 7-day average for hospitalizations is more than 1,600 people. Barnes Jewish Hospital says 4 of its St. Louis area hospitals will start rescheduling some elective surgeries until at least November 20th. The Johnson County Health Department says it is seeing a large number in the new cases of COVID-19.
There's been a 75% jump in cases in 1 week's time. KMBC 9's Kelly Gibbs live at the County Health Department, where the health director is calling this trend alarming. Kelly.
He is, Chris, and he's also saying that these new numbers indicate high community spread. He's recommending everyone stay vigilant. The Johnson County Department of Health and Environment is now reporting a 75% jump in the number of cases of COVID-19 in just 1 week. A majority of those cases, residents who are 20 to 60 years old, many reportedly convening in crowded restaurants, bars, or at other social gatherings.
We were expecting the spike to be associated with key events like Halloween, like Thanksgiving. And so if we are already at this level, it's going to present a challenge unless we do something about it.
A report obtained by ABC News shows both Kansas and Missouri are in the red zone for COVID-19 cases, with the 11th and 19th highest rates in the country. Both states are also in the red zone for test positivity, indicating a rate at or above 10.1%. Dr. Ariola says the increased community spread in Johnson County and beyond is putting schools, hospitals, and vulnerable populations at higher risk of infection. He's now stressing the need for everyone's vigilance to curb the impact of the virus.
It's not the time to let up. You can't let up. If we do, the consequences are not going to be good.
And Dr. Ariola also reinforcing this is a critical time to stay vigilant as we approach the holidays, where typically people gather, and then those colder winter months where many are forced to stay inside. Reporting live in Johnson County, Kelly Gibbs, KMBC 9 News.
The health director says misinformation regarding the pandemic is becoming an increasing problem. He says the best way to curb the spread is by following the recommendations the CDC laid out from the start. Do not attend large social functions, wear a mask, and stay home when sick.
COVID-19 has given all of us reason to think differently about the way we live.
This Sunday night in Chronicle, a systemic pandemic, we explore how people in the Kansas City area are being disproportionately impacted by the virus. It's affecting all aspects of life, including healthcare, housing, and education. People say change needs to happen because of what COVID-19 has magnified.
I think the question is simple. Do you believe that everyone should have what you have? And some people will say no to that, right? Some people don't actually believe that everyone should have health care or everyone should have stable housing. And I would see myself as distinctly in disagreement with those people.
Chronicle, a systemic pandemic, airs this Sunday, November 8th at 9 p.m., followed by KMBC 9 News at 10.